This is a pain that a lot of people won't understand until it hit home. They called me into a room. When they called me into the room, I was like, I already know what they was going to tell me. I don't even have the words to express, because the pain I feel inside, I don't think no mother or no parent should see the child lying motionless on a sidewalk. I just miss her dearly.
In the last 10 years, we've really learned that the SAFE system works across all countries. This is the UN SAFE Systems approach. And really, in Trinidad and Tobago, what we have seen is that implementing the different topics, the different areas in the SAFE Systems approach by government departments, the UN, NGOs, has been very effective in reducing the number of road fatalities by 50%.
This was based on the 5 pillars. 1, road safety management. 2, safer road and mobility. 3, safe vehicles. 4, safer road users. And 5, post-crash response.
From 2011 to 2020, the Ministry of Works and Transport invested heavily in the engineering field. We set up a National Traffic Management Center where we were able to monitor vehicle activities on the roadways. This was a pilot program, and within that pilot program, we had set a red light enforcement camera system, spot speed enforcement camera system, and data collection devices, where we place a lot of data collection devices across the roadways, where we can see and track how motorists use the roadways. So the hardcore things that we invested in were barrier systems. We had cable barriers, we had utility barriers investment, and we had energy and absorbing barrier systems. For example, crash cushions, sand barrels, and all of those sorts. We invested in machinery to paint the roadways. Back in the day, we used to paint the roadways using brush and paint, traffic paint. We invested significantly in thermoplastic applications, where we utilize machines that burn the roadways so that we get a longer shelf life, greater effectivity and durability of the roadway.
We had to first of all look at our data, the collision data, the demographics, temporal, analytics with regards to behaviors, analytics with regards to geospatial locations for the accidents, and what we call problem analysis, collision hotspots. The data was a critical part for us deciding how we were going to tackle this problem. After we looked at the problem, we also had to look at our resources. What were the current strengths? What's the level of motorization in the country? Also, what was the legislation deficiencies or assets that we could use to enforce in order to tackle this issue?
In the last decade, the Ministry of Health has taken a number of actions to ensure that road safety fatalities are dealt with in the appropriate manner. So, beginning at the crash site, we have ensured that the distribution of medical ambulances throughout Trinidad and Tobago are well distributed to allow for a very quick response time in keeping with the global average and best practice. Thereafter, they are taken to the accident and emergency departments. There are 105 primary care facilities, 13 hospitals spread across both islands, and they are well equipped in terms of personnel, trained mostly to the doctor of medicine level in terms of the physicians and everyone else that is required, together with the necessary equipment to ensure the best post-crash response possible from a health perspective.
Road safety is a very multifaceted subject, and it requires input by several different stakeholders. The general public, the man on the street, that's where Ride and Ride would come in, representing the citizenry of Trinidad and Tobago.
We were able to build closer working relationships, not only from the standpoint of lobbying for legislation, but also for education. Educating persons on safe road use, defensive driving practices, and more importantly, complying with the laws was a key part to getting the public on our side.
our stakeholder engagement, and in particular, not just with our ministry partners, but with our NGOs, and in particular, Arrival Land, it has done wonders in terms of not just working together on projects, but really an understanding, and that advocacy aspect has gone a long way to make sure that we stay on.
We also work together with the Ministry of Works and Transport in developing new legislation, and that includes development of spot speed cameras, demerit point systems, and deployment of technologies such as electronic ticketing systems to help make the enforcement much more efficient, transparent, and accountable on both sides.
We also look into the vulnerable road users, such as the pedestrians. In the inner cities, urbanized areas, we painted a number of pedestrian crossings at all intersections. We created a safe space in the Sharamas area, where cyclists can freely ride the roadways where separated from motor vehicles. We also looked at the persons with disability, accessible pedestrian signals where the blind can safely cross our roadways. Pressing the button and they will hear an audible informing them of when they are able to cross the roadways.
On behalf of the Commissioner of Police of the Trinidad and Tobago Police Service, we welcome the partnership with the United Nations World Health Organization to support the second decade of action for road safety, 2021-2050.
As a government, our goals for the next decade will be a further 50% reduction in road fatalities. The Road Safety Council, which have been established with all agencies to ensure that all our roads remain safe and a continuous improvement of all our infrastructure.
Now, going forward, what has been done is that the concretization of the responses across the sector through the Road Safety Committee last year allows the Ministry of Health to have a more comprehensive role in terms of public health and what we do in terms of finding solutions to road safety. So not only Pillar 5, which is post-crash response from WHO, the ministry now has a role and can lend its voice towards Pillar 1, 2, 3, and 4 as well in a more cohesive way so that we actually get to the causes of the road traffic accidents and try to get solutions from a public health perspective.
For this next decade, we are going to partner much closer and collaborate with other state agencies. For example, Ministry of Rural Development and Local Government, Ministry of Health. We already partner very closely with National Security through the Trinidad and Tobago Police Service. We are going to pin ourselves to the new decade of action